Hello guys, in this video we want to talk about monkeypox, its symptoms, diagnosis, vaccine and treatment. So stay with us until the end of the video. What is monkeypox? Monkeypox is a rare viral and contagious disease caused by infection with the monkeypox virus. This virus belongs to the orthopox family, which includes smallpox and cowpox virus. Infection with this virus has occurred mainly outside of Africa and in people who make international trips or import animals, and the highest rate of infection was in countries such as the United States, Singapore, Israel and the United Kingdom. During the past years, very few cases of monkeypox have been diagnosed in the world, but now countries such as Belgium, Germany, France, Italy, Spain, Sweden, Portugal, England, Canada and the United States have reported cases of this disease. And after identifying more than 100 cases of monkeypox in Europe, a meeting was held at the World Health Organization. The main source of monkeypox is still unknown, and it seems that African rodents and monkeys can play a role in transmitting the virus and infecting humans. In severe cases, which usually occurs in children, this disease depends on the level of initial contamination and the physical condition of the child, and if a person is suffering from diseases of weak immune system, he may experience more severe degrees of the disease. The death rate from monkeypox is about 3 to 6%. Signs and symptoms of monkeypox. The signs and symptoms of monkeypox in humans are similar to smallpox, but can be milder. This disease is mainly associated with fever, headache, cramps and muscle pains and fatigue, and the only difference with the symptoms of smallpox is that monkeypox is associated with swelling and involvement of lymph nodes. The time it takes for symptoms to show themselves from the time of infection is around 7 to 14 days, which in some cases can take 15 to 21 days. Usually 1 to 3 days, or more, after the fever, we will see skin rashes that are first seen on the face and will be transferred to other parts of the body. The progress of the lesions will be as follows: spots, boils, blisters, purulent boils, skin bumps and scaling, and the person will be affected by the disease for approximately 2 to 4 weeks. How is monkeypox diagnosed? According to epidemiologist researchers, the most accurate and best method to diagnose monkeypox is to take samples from skin blisters. This type of test should be performed by specialized personnel through PCR testing in the laboratory, and the safety of people should be fully respected. In this way, a sample is taken from the surface of the lesion and a virological test is performed to diagnose smallpox. Unlike corona, this virus does not have a specific diagnosis, because tests based on antigen and antibody do not work to detect this virus. Therefore, it is not possible to find a way to identify this disease through a blood sample. Ways of transmission of monkeypox. Monkeypox is transmitted when you come into contact with the virus through infected people, animals or objects, in which case the virus can spread through open pores on the skin, respiratory tract, or mucous membranes of the eyes, nose, and mouth. Enter the body. Transmission of monkeypox from animals to humans can also be done through bites or scratches, directly in contact with waste liquid, or indirect in contact with items such as bedding and quilts. Note that monkeypox can also infect mice and rabbits. Human-to-human transmission of monkeypox occurs primarily through respiratory droplets, but since these droplets cannot travel more than a few feet, if you have prolonged face-to-face contact with an infected person, you will be exposed to infection. Direct contact with liquids or waste materials, or even indirect contact with these waste materials through contaminated clothes or sheets, can be other ways of transmitting the virus. The main source of monkeypox remains unknown, although African rodents may play an important role in the transmission of this virus to humans. The virus that causes monkeypox has only been isolated twice from an animal in the wild, first in 1985 in an apparently diseased African rodent in the tropical Republic of the Congo, and second in 2012, from a mongoose, a type of great ape, was found dead in Tay National Park in Ivory Coast. Ways to prevent monkeypox. By following a series of tips and measures, you can prevent the monkeypox virus. Actions such as avoiding contact with animals that may be carrying the virus, including animals that are sick or known to have died in areas infected with the virus. No contact with any items such as bedding and sheets that have been in contact with a sick animal. Quarantine people who may be carriers of the virus. Observing personal hygiene and washing hands after contact with infected people and animals. For example, be sure to wash your hands with soap and water or special hand alcohol solutions. Use of special equipment when caring for sick people infected with the virus. Treatment of monkeypox. The way to diagnose monkeypox is through sampling of lesions created on the skin using PCR, and currently there is no proven and safe treatment for monkeypox, and to control this virus in the United States, measures such as smallpox vaccination, drugs antiviral or immunoglobulin vaccination is considered. Most likely, you all have heard about monkeypox by now, but you are still confused about this new disease. Monkeypox is a new viral disease that has recently increased in prevalence and incidence. The monkeypox virus was first discovered in 1958, and most of its patients were found in countries with rainforests in the African continent. In May 2021, a Chinese veterinarian died of monkeypox. Since then, more than 100 cases of monkeypox have been reported in Europe by the World Health Organization. Also, cases of this disease have been seen in the Asian continent and even near Iran, UAE. It should be seen how dangerous and effective the spread of monkeypox virus can be. The effect of vaccination against monkeypox. Medical staff and epidemiologists consider public vaccination to be the best way to prevent the spread of monkeypox. These people recommend that first people who are in close contact with people with monkeypox or who have a higher chance of getting infected should be vaccinated, and then other people will be resistant to this disease. It is also necessary to consider targeted health strategies through governments to curb this disease based on the available data and statistics. Considering that monkeypox is a rare disease and there is no specific treatment for it, it should be prevented as much as possible. How much has monkeypox spread in recent weeks? The World Health Organization has so far reported several cases of monkeypox, including Canada, the United States, Australia, and 9 European countries. In addition, more than 100 suspected cases have been recorded in other parts of the world, which increases the possibility of further spread of the monkeypox virus. For this reason, the World Health Organization has raised its readiness for this disease to the highest level. According to the researchers of the NHS Institute of England, the process of contracting this disease is from mild to moderate clinical level, and most of the patients recover within 4 weeks. Also, according to the experts of this institute, the transmission and contagion of this disease is not easy and its general spread like corona is unlikely. Of course, the cause of the emergence and respread of this virus after several decades and from the origin of Africa is unknown. However, there are possibilities of genetic modification in the virus. The genetic changes in this virus have made it more contagious than the previous generation of the virus, which was almost extinct. The director of the European Department of the World Health Organization has warned that with the arrival of the summer season, the increase in the amount of travel, gatherings and tourist activities, the risk of transmission of monkeypox increases, because tourists show more willingness to travel after the end of the corona pandemic quarantines. How dangerous can monkeypox be for us? According to experts, monkeypox disease is largely self-limiting and does not have severe complications. But some severe cases of the disease may occur, especially in children and people with underlying diseases, which also depends on the initial dose of contamination. Especially diseases related to immune deficiency can worsen the situation. Complications of monkeypox include pneumonia, blood infection, brain infection, encephalitis, and corneal infection. Therefore, things like loss of vision, death of body parts and chronic lung diseases are possible. The duration of the disease is between 2 and 4 weeks, and according to sources, the mortality rate is about 10%. Of course, the World Health Organization believes in 3 to 6% and states that the new strain of the disease may be different. Is it possible that monkeypox will lead us to quarantine again? The monkeypox virus is very unpleasant because of the unpleasant and frightening side effects it causes, and these days many people question whether this disease can spread widely. This disease is known with 2 mild and severe strains. The mild strain of this disease is mostly seen in West Africa and its stronger strain is mostly seen in Central Africa. The reason for the difference in the spread and severity of this disease is still unknown. What strategies work for dealing with monkeypox? Most specialists have been monitoring this disease since monkeypox was eradicated in the 1970s. Initially, smallpox was a very epidemic and dangerous disease that, thanks to universal vaccination, was no longer considered a threat to humanity. However, health officials advised that complete eradication of monkeypox should also be considered. Since then, monkeypox has been diagnosed many times in different parts of the world, most of them in African countries. For example, in 2017, the health authorities of this country know about 500 suspected and 200 confirmed cases of monkeypox. Also, in 2003, America reported several cases of this disease. The transmission of this disease in America is mostly due to contact between people and pets. However, public health officials and professionals are relatively well prepared against monkeypox. For example, there is a specific antiviral treatment technique to deal with smallpox. Also, the United States of America and some other countries keep a shipment of special vaccines for this disease. Also, according to experts, people who were vaccinated against smallpox in childhood have more chances to prevent and deal with this disease. If you like this video, support us by liking and subscribing and don't miss the suggested video.